Thanks everyone for being here. We are going to get started with our panel in a minute. I think I just need some assistance in terms of having the screen set up so that we can see all of our panelists.
I will work on that. Thank you.
Thank you so much. We have 6 wonderful experts in scholarship with us here today. But yeah, I'm hoping we can get them all on the screen at one time if everybody's here. Let's see, Dr. DeWitt, and then I don't see Dr. Ray yet, but I know he's also going to be joining us on his lunch hour, so he may be running a little bit late. So we can get started, and if he joins us, if we could just add him to the group, that would be great. Well, for those of you that have been with us all morning, thank you so much to our presenters. We listened to some really, really great research from our trainees this morning that was very exciting to hear. And I appreciate all of you being here on our panel today and taking time out of your day. I love just for you guys to go around and kind of introduce yourselves. I'm hoping your screen looks like mine and Dr. Sood is in the upper left-hand corner for most people. If that's true, we can kind of go across the top and then come to the bottom row. If not, then whoever speaks up first can go. But yeah, if you want to just tell us, who you are, where are you calling from, and a little, a couple minutes of a little bit of background in terms of what most of your scholarship has been in, that would be great to get us started.
Happy to start. And thank you for this opportunity. Hello, everyone. I'm Lanika Sudan. I'm an associate professor at Washington State University College of Medicine and the vice chair for internal medicine. I'm a general internist practicing hospital medicine at a community hospital in Spokane. My scholarship journey began during residency when I wanted to be a nephrologist, but later on decided not to. But it was really formative for me as I had the opportunity to work with incredibly prolific faculty, one of whom had actually coined the term osmotic demyelination syndrome. So they were really invested in studying the therapeutics for moderate to severe hyponatremia. And their mentorship led me to present at a few national venues in terms of nephrology conferences, as well as an important publication. But more than the actual lines on my CV, this offered me an opportunity to learn from them on how to develop the ethics and habits of successful scholars. I've also completed a master's in health professions education, and that's demonstrated the need for an intentional approach towards scholarly work. One advice I received early from a number of mentors was to develop a program of research, which means to identify your scholarly focus and continue to work towards that niche. My experience has been slightly different. I have realized about myself that I'm a generalist through and through in clinical practice as well as my scholarly work and education. So, in the past few years, my research has been a little bit all over the place, but primarily focusing on the scholarship of teaching and medical education. I've published papers on residency applications and some novel interventions, assessment science, as well as curriculum development. Like all my colleagues here and all of you, I'm a lifelong learner, so I'm here to learn from all of you today. Thanks for having me.
Great. Am I next?
It looks like it for me.
Okay.
Yeah.
Please
Thanks.
tell me if I talk too long. My career has gone through lots of different paths, and I have so much to say, but I'm going to keep it very brief. I'm Kay Johnson. I'm a general internist at the University of Washington. I'm in the clinician scholar track at the did I say at the UW? I'm based at the VA Puget Sound in Seattle, and I've been at the Seattle VA for 27 years now, but I really think I've had 3 careers within that. But I'll just first start. I was a chief resident and I was very interested in women's health. I wasn't sure how to get started in scholarship. I wasn't aware of much research going on. I asked my attending, my oncology attending, if they knew anybody doing women's health research. And she hooked me up with somebody from the Hutch, which is, the name keeps changing, but it's Seattle Cancer Care Alliance, who was about to start a study on breast cancer screening at Harborview. And because I was motivated and I had a little protected time, they took me on, and I took on part of that project. And so that was kind of my first academic project. I learned a lot. And then I decided to get a master's degree in public health. I wasn't sure I was going to go into general medicine. I thought, like Dr. Sood, I was thinking about going into pulmonary medicine. But I did a fellowship where I got my MPH paid for. I had an opportunity to travel to Peru, where I studied HIV and syphilis in pregnant women there. And that was a great experience. I had 2 babies during that 3-year period of time. And then I decided I wanted a hard money job and not to have my career based on having to write grants. My husband was going that route. It made me a little scared that we would both be doing that. And I just wanted to teach. So I basically took a job at the VA as the new women's program director for women veterans, because there was a giant explosion in the population of women veterans coming to the VA. I did a ton of teaching on menopause, breast cancer, contraceptives, all sorts of things. And I bring this up because I think when I was giving talks, I tended to try to make them a bit academic and not just go by what the review articles were saying. I would go back and read the primary papers and develop my own ideas about and my own interpretations. And I was very active in going to SGIM, Society of General Internal Medicine meetings, and I would always go to the women's health panel, where they'd have like 4 people who would put together all the information, all the most important articles from the prior year. And at some point, I felt like I had enough confidence in my knowledge base. I asked them if I could be one of the speakers for that. And that really just opened up so many opportunities for scholarship for me. I started to develop my national reputation in women's health. But then I started also getting interested. I took on a position in the School of Medicine's colleges faculty, and I just loved that so much. And my career kind of took a different direction. That is not the most efficient way to kind of get promoted, to take all these twists and turns, but I loved that. And I started phasing away from women's health and primary care, and I was doing medical education and pre-op. I did do some scholarship while I was on the School of Medicine colleges involving medical student sleep. And then the School of Medicine restructured. I kind of, about 10 of us got cut from that program. And I looked around the VA and thought, okay, what would be interesting to do? And they were trying to eradicate hepatitis C. And I said, could you use a general internist to help you in that clinic? And so now basically I've spent the last 12 years, even though Hep C is almost gone at the VA, I've become a hepatology clinician in the pre-op in the hepatology clinic, and continue to work in pre-op. And so this is kind of what has become my scholarship niche now, is risk assessment and outcomes of patients with cirrhosis who want to have surgery. And I joined a group of run by Georgiano, who is a physician scientist, became part of that group, and have used data that he had to write some papers that were important to me. And just to wrap up now, I am finalizing a calculator to be used for patients with cirrhosis and what the risk prediction is. And finally kind of developed a second national reputation in the perioperative and cirrhosis world. And so finally got promoted to full professor. So again, it's been a great, rich, interesting career, but not the most efficient way to do things.
Looks like I might be next. Is my mic working okay? I'm Scott Hagan. I'm a primary care doctor. I work at the VA. I have a faculty appointment at UW. I'm an associate professor, clinic director here as well. Let's see, my research interests are in obesity and the implementation of prescribing anti-obesity medications in primary care at the VA. Also interested in patient safety and the use of clinical informatics to enhance that. And clinical reasoning would be kind of the 3 different buckets that I've been in. I'm primarily not research. It's only 20% of my time. And I think my journey has been, I've long had some interest in doing health services research or QI/patient safety related research. And I was debating doing a GIM fellowship after internal medicine residency, ultimately chose not to after a chief resident year. And I think that was kind of one step in a path that ultimately led to a very different series of events as far as my research career. So I'm primarily not grant funded for indefinite periods of time to do studies. And as such, and that may be the case for others on this call, the theme of my research life has been be scrappy. If you're interested in a project and you work with someone you admire, a mentor, try to make it happen. And often, depending on your setting, and where you're training, there are smaller grants available to do such things. And I've had a graveyard of projects that have not worked out. There's been something I've worked on for 5 years that has yet to produce a publication. I still hope it might. And so I wouldn't get discouraged if a project you thought was a really good idea is not working. There's still a lot to be learned from that, and just continuing to go back at it if that's something that brings you joy is the name of the game, at least for me in GIM related research. I'll stop there.
I think I'm up next. My name is Vince Reichel. I'm a hospitalist, also at the Seattle VA, and have a faculty appointment at UW. I'm an assistant professor. And also, as part of that, I run the clinician educator pathway for the internal medicine residency. And so pretty much all of my scholarship exists in the medical education world, and even more specifically, GME, internal medicine, pretty specific. Some of the things I've been interested in are feedback delivery, formative feedback. What are the barriers, which there are many in terms of delivering higher quality feedback, and then what can we actually do to improve that? And so, the end goal of a lot of my scholarship is to try to create a more effective, welcoming learning climate for residents. And so that takes the space of creating curricula, which can be published and turned into scholarship. And then also the other side of it is like really kind of understanding the problems and get diving into that before we figure out a solution. We want to figure out what the problem is. So one project working on with a current chief resident is really trying to understand the resident experience in managing behavioral emergencies. What's going on with the resident? How are they navigating these situations? What training do they have? And so it's been really rewarding. And I would say, a lot of the previous people have spoken about the importance of mentors. I couldn't stress that enough. And for me, early on, it was like the mentor is more important than the project, right? Because I would learn more about how to do a project from that mentor that I can then apply now on my own to things that I'm really interested in. I definitely had situations where I had my dream project that I wanted to do, and I didn't have the right mentor, and then that's a really challenging spot to be in. And like Scott, I have a small portion of my FT kind of assigned to scholarship. And I would say the effort and passion can often outweigh that in terms of the hours per week. And so it really is important to find things that fill your cup and really bring you joy. And part of this is that the scholarship is a real opportunity for collaboration and working with people that you find you really like. And that's what really I love right now. I love working with some of the residents in the clinician educator pathway who are passionate about medical education, mentoring them on scholarship projects. And that's an opportunity for us to be working more longitudinally, while also working on a challenge or problem that we both find interesting.
Wow. I'm not sure I can add a whole lot, but I'll just make a few observations. First of all, it's great to see all the people on the screen, some of whom I have known for 30 years. And the scholarship thing, it's hard. You go to medical school, and unless you're going to do an MD, PhD, you're like, I'm going to be a doctor. And then you find all these things that hopefully light your fire a little bit. And like everybody else here, I thought about doing a fellowship of some sort. Mine would have been in GIM, but I was a little bit older. And so I had to go get a job and pay off my loans and all those things. But mentors, so I started at UW and did some projects with Earl Hirsch and Doug Powell and some folks like that. And they were wonderful mentors in getting me pointed in the right direction. I did some years in faculty development and medical education, and then I got sucked off to Australia for 9 years. And the interesting thing is, how do you keep those collaborations going, and especially professional collaboration opportunities like ACP or Society of General Internal Medicine? Those places can be incredible places to meet people with like-minded interests and projects. And if you can, as a junior person, get yourself into a national collaboration early. Of course, once you get into the collaboration, then you got to do the work, which goes to the kind of comments about nights and weekends and effort versus allocated time, right? I've had everything from no allocated time for scholarship to probably 20% was my maximum allocation for scholarship. But that meant that when I did a systematic review of insulin and use in diabetes, I literally carried around a box with 400 papers with two toddlers for about a year trying to do those papers nights and weekends. And luckily, I had a supportive partner. So, I think you definitely have to choose your questions, and then you have to have a lot of persistence and grit sometimes to get projects through. And I liked Dr. Hagen's comments about the failed projects. I have a few folders that are more than a few folders of things. Great ideas are everywhere, and then it's the operationalization, which brings me to probably colleagues. And 6 years ago, I got a call at winter holiday time from a nursing PhD colleague of mine saying, I need an MD to be a PI on a grant. And I had had some small grants, but I'd never been a PI on, well, I'd been a PI once on a big diabetes grant, but um, this was like way out of my wheelhouse. And I was like, how much time is this going to take? No, 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 I'm already full up. And the interesting thing was, it was one of the best things I ever said yes to. So this is when you're looking at your work-life balance and all of those things, everybody has to make their own choices. But I made this choice that got me into an incredible world of interprofessional simulation education with some highly talented nursing colleagues and pharmacy colleagues that just completely expanded my world. So when you get opportunities, one bit of advice is to, have a friend or a mentor who you call and go, should I do this? Like, do I really want to do this? And why do I want to do this? Or don't I want to do this? And have somebody to bounce those ideas off. Um, but since then, what I've learned is I am not a statistician, but now I have these wonderful colleagues who can do that. And that has expanded my ability to do research in areas that I haven't before. And we recently submitted and then got rejected a paper with Dr. Sood, who has a whole nother set of skills that, is just fantastic to have her as an amazing colleague. So you don't have to know everything, but finding colleagues who can do those complementary skills is just a gold mine. So I'll just stop there and say good luck, everyone.
Thank you. And yeah, anyone from the audience, definitely feel free to put questions in or raise your hand or speak up. We only have 15 more minutes or so. But in lieu of those other questions, I think I heard um, everyone kind of comment on kind of two different things. One, either extra training or not, that was helpful. So yeah, I wonder if those who had any additional training, if they felt like, to someone in the audience who like knows I definitely want scholarship in my future, is that worth the time? Is that worth the money? Is that necessary? What would your advice be about that? And the same for folks that didn't have extra training. Um, and then also everyone, of course, spoke about mentors, but I wonder if there are any little like nuggets of like gosh, I know they're a good mentor when X, or like a red flag of a mentor to run away from. Things like that could, practical advice that could be helpful for our audience. I would love to hear more about those things.
Well, regarding the extra training, definitely the goal would be not to pay out of pocket for a master's degree or something, to do it within a fellowship program, if possible. And it is a big commitment. And for me, it just put me much farther, even though I wasn't accumulating more debt during that time, it put off another 3 years, which is impactful. And I loved the epidemiology classes and some of the things I did. I thought biostats was pretty hard, but great, to learn. So it's really hard to know. I guess I'm glad I did it. But it just, and if you want to do quantitative research, I do think you have to do something like that, unless you already have a PhD or something. So that's all I have to say.
I can speak to my experience with the question in the chat of, in your experience, what is the balance between taking on project roles voluntarily without funded time? So medical education is work done by volunteers by and large. That is like how the reality of the situation is. And I think that balance is, there is not a one size fits all. It is all like kind of like what works for you. I think the reality, at least currently, is, especially early in your career, taking on a couple things that are probably unfunded if you're interested in kind of a medical education space, to kind of get involved in the space and know people is important. But centering that with your why, like, what is this? Is this like something you really enjoy? Is this going to get you connections? Is this going to help you in some way? Because you can say yes to many things and all of a sudden you're overbooked and it's too much, right? And so there's a balance. Like, you don't want to be kind of like eaten alive by volunteerism. You want to pick things that do advance your career and your joy, and then be explicit about, like, like, if your goal is to get FTE, like, you shouldn't be like, that shouldn't be a secret that you hide from somebody. Like, your whoever is your boss should know that that's like something you're wanting to do, and you're demonstrating your interest by doing these things, like teaching in this course or doing this scholarship, and with the understanding that at some point this will turn into something. Um, that would be but what that balance is kind of different for everybody. On the question of the mentor, I think the biggest thing is like you as the mentee should be the biggest product of the project, right? So the mentor should care about you, like, as a person, and that should be like your sense. Like, if the mentor is using you to support their project, like, that's not, in my mind, like as good of a going to be as good for you as somebody who's like investing in you, right? So that you come out of this as like as a more full researcher that can move that forward in your own scholarship points.
Thank you. Does anybody else want to comment or have anything else to say to Anita's question?
Sandra, I wanted to kind of combine the question about additional training and what Vince was just saying about educational volunteers, and put in a plug for chief residency. It is one of the rare opportunities to actually get paid to be an educator early in your career. We have some former chiefs on the panel. I don't know what they would say about that, or if Monica's still around, she could certainly comment. But I think that is kind of if it is an opportunity that arises for you, it really is kind of unique in how it is timed and what you get to do.
Yeah, I'll just echo that from Chris. When I was the chief resident at UW-MC, I said, okay, I got to do all this admin stuff and I get to do all this teaching stuff, but I'm going to also do a project for a year. And that was a real opportunity to find a mentor, get a project, and say, hey, I'm the chief resident. I have to do a project. I want to do a project. And I think that's a great opportunity. And I also did the certificate in medical education at UW, probably, I'm trying to think how many years later, 6 or 7 years later. So I was almost an associate professor when that happened. But I think those kinds of certificate programs that a lot of places offer, Usually you can do that without having to pay for them. It's not a master's, but it'll introduce you to a cohort of colleagues, and it'll usually you can get a little bit of protected time to do that. The other thing is a lot of people end up doing administrative roles that sort of give them access to data, especially in the educational space, or to problems that they can then turn into scholarship.
Scott, do you want to go ahead?
Go ahead.
Please. I was going to just maybe take a stab at the mentorship question as well. So over time, I think I've come to realize that a mentor is not just a mentor, or a good mentor is also a coach, a sponsor, and an ally, especially in the context of those of us who are perhaps underrepresented in leadership or scholarship in medicine and medical education. And what I mean by that is if your mentor, of course, is teaching you something and you are, just like Vince said, you are the best product of that collaboration. Behind your back, they're picking up the phone and calling a colleague and saying, I have this fantastic resident or student that I work with, and they have an incredible work ethic, if you do, of course. And I am willing for them to put my name behind them, to recommend them for this fellowship, etc. That's the kind of stuff that helps open doors for you when you're not at that table. And it's not just scholarship, I think it's life. I think it's medical education, I think it's medicine, but something that I haven't appreciated until about 10 years ago. So I'll say maybe a red flag is if your mentor is not those people, maybe explore why that may not be. Maybe that's not the relationship to be in.
I would just add on the mentors that it's important not to overthink some of this, and that like sometimes you just don't have it's not like we have a Rolodex of mentors available for certain projects. Like especially in training, there may be like a couple of areas of interest to you and only a few people in that area that are doing that work. And I think just being open to the idea that you're not committing yourself to an indefinite relationship with a mentor when you're starting a project, and things may or may not work out, or you may learn a lot in the process of working with someone that can help you decide, like, we're going to finish this project and then I can decide, do I want to keep working with this person? I think a lot of times in training, what happens is these accidental mentors, and the best example that happens all the time is, hey, we should write up this interesting case that happened on our clinical team, and it's someone that you don't know what their research interest is or anything like that. And that learning process sometimes then turns into a longer term relationship with that mentor. But yeah, I've had double digits mentors in my career, and some worked out better than others. I think it's a mixture of personalities, and just because your colleague has worked with someone and to them that felt that was a good mentor relationship doesn't necessarily mean it's going to work well for you. And I guess just the main point being that you will have lots of opportunities throughout each stage of your career to seek new mentors and kind of learn from past relationships if you don't feel like the fit was good. And that helps as you kind of refine what your interest areas are in your projects and selecting those people.
And it's super important it's almost overwhelming sometimes at places like the UW where there's almost too many people to pick from, and how are you going to focus? But I think it is really important, if you don't see mentors around you, to look more broadly through ACP or SGIM or other organizations. They just, especially these days, do not need to be in your same city. Oh, and I was just, again, going to emphasize the importance for me, who was I was quite introverted and had some imposter phenomenon going. Just the times when I was brave and reached out to somebody, I was so glad I did it. I was interested in writing this opinion piece on perfectionism, and I reached out to this guy I had just barely met once, and Stuart Slavin, and then he collaborated with me on this project. It just doesn't hurt anything. It's a little bit embarrassing if you're a shy person, but especially if they're far away. All they can do is say no. And I've been so glad when I've just reached out and emailed somebody and just to reach out.
Can I emphasize that again, Kay, now that you and I are both professors and developing gray hair? The asymmetry of that is really remarkable because if someone reaches out to me, even if I'm going to say no, I will usually think about who else could help. So it's like there is very little to be lost in like cold calling someone in a topic that you know that they're interested in, and they'll just be like either, hey, that sounds really cool, tell me more, or I can't really do that right now, but maybe there's someone else who might be able to help.
I love that. Thank you, everyone. Um, any last final parting words? Why do we do this? Why do we love it?
I love the phrase failing forward. So you get to fail a lot in life and in scholarship. But it's worth it if you learn something from it. So all of us have failed a lot of times. I don't know my colleagues, but I think they'll agree with me as well. So don't be afraid of failure, but learn something from it.
Thank you. Well, thank you so much, panel. I really appreciate all your time. I know you're all very busy people. I'm sure you're giving up your lunch break to be here, but I really appreciate it. Thank you.
Okay,
Thank
thanks.
you.
Now
Thanks.
we'll hear about our winners. Everyone did so great today. Thanks for being here.
Thank you, Dr. Demars. Yes, that was wonderful. I think really inspirational words. And I just want to echo what Dr. Sood said. Yes, many failures are opportunities to grow and learn from, and there have been many. So, so with that, kind of the polar opposite, we had some excellent presentations today, and also for those who were able to stay on during the break, you had a chance to see some of our top poster presentations. So for those who, again, it's your first time attending, we have both oral presentations and poster presentations. There were a number of other posters that had really wonderful work that were put together that we weren't able to share today. So I just want to call that out and acknowledge all the really excellent work and the help from mentors to put all these together. So with that, we're going to go ahead and announce the winners. We're actually going to start with an honorable mention in our medical student category for Jessica Liu from Washington State University, who had a really insightful project regarding mammography and breast cancer screening. Now, our winner for our top medical student placement goes to Sajal Dalawal, who presented earlier today. She's from Pacific Northwest University of Health Sciences and is investigating kind of the impact or the mechanism for statins to impact diabetes progression. So really fantastic work. Next, we're going to announce our resident poster winner. And so Dr. Christopher Valentin from Washington State University. Dr. Valentin also did an oral presentation, and this award is for his poster presentation looking at improving the treatment of heart failure with reduced ejection fraction and goal-directed therapy in the clinic. So that then gets us to our top 2 oral presentation awards. So our first is for our resident top oral presentation, and this goes to Dr. Catherine Milke. And again, I'm sorry, I think I mispronounced that again, but with Washington State University, who had a phenomenal project on looking at reducing telemetry use in the hospital. And just really, really excellent kind of the way she walked through it and explained the rationale and then thinking even about next steps. And then our overall oral presentation winner today goes to our actual final presentation from Dr. Anita Vasudevan and Dr. Monica Soni from the University of Washington on their wonderful work to reduce the risk of relapse of DKA. So I want to give a round of applause to everyone and to our winners. So for our next steps, Whitney with our ACP team will be reaching out to all of the winners with a letter and kind of the next steps. And also, I think I just want to call out that we will have another abstract competition in our fall conference. And for those who haven't had a chance to attend the ACP Fall Conference, it is a wonderful chance to bond with others, to meet and to share, and just a wonderful chance to network, and also really good learning, good food, which is also really important at a wonderful venue. And so congratulations, yes, to all of our winners and to all of our participants. And I think, Dr. Wheeler, if you would like Any other kind of final or concluding thoughts?
No, just a big thank you to everyone involved. It was a big team project and great to have everybody participate, and wish everybody a good afternoon.